When accidents occur, our first reaction is to help the victims. Yet, few have the sufficient knowledge to achieve this goal. First aid is the immediate treatment given to the victims of accident or sudden illness before medical help is obtained. It is the skill of applying common sense so that suffering ends, life is saved, and recovery begins.
Bleeding occurs when the skin is cut. In most cases of bleeding, prompt action can prevent it from becoming fatal. If severe bleeding occurs, remove clothing around the wound. Press down hard on the wound with any absorbent material such as the inside of a clean folded handkerchief. Raise the wounded area above the level of the heart and apply pressure to reduce the blood flow. When bleeding stops, tie the dressing with a bandage. In the case of an abdominal wound that runs across the body, lay the casualty on the back. Gently remove clothing around the wound. Cover the wound lightly with a large dressing. If sterile dressing is not available, refold a handkerchief so that the unexposed side faces the wound. Bend the knees and support it with a cushion. Raise the head and the shoulder. This will relax the abdominal muscles and help to keep the wound closed. Fix the dressing with a bandage. The bandage may be passed under the back with the help of a twig. If you cannot get the bandage under the back, secure the dressing with an adhesive tape. Knot the bandage away from the wound. Loosen any tight clothing to assist breathing and blood circulation. If the casualty complains of thirst, moisten his lips with water but do not give him anything to eat or drink. Lay the casualty flat on the back in the case of wound that runs lengthwise and cover the wound with a clean absorbent material. Raise the feet slightly and fix the dressing with a bandage. If the casualty coughs, support the wound by pressing gently on the dressing to prevent internal organs from protruding. Dressing and bandaging is an important part of any good first aid practice. Wounds usually require dressing, and almost all injuries will benefit from the support that bandages can give. Great care must be taken in handling and applying dressing. Wash your hand thoroughly. Cover your mouth to prevent talking or coughing over the wound. Do not touch any part of the wound or dressing that will be in contact with the wound. A dressing not only covers and protects a wound from infection but also absorbs discharge, controls bleeding and prevents further injury. Bandaging is a skill that can be mastered by practice. Always use a suitably sized bandage. Start at the narrowest and work towards the widest. Roll from the inside to the outside, holding the head of the bandage. An efficient dressing must be sterilized and have a high degree of porosity. Knot the bandage away from the wound by looping the bandage onto a finger and tie it with the other end to make a reef knot. In the case of wound with a foreign object, squeeze the edges of the wound to stop bleeding. Do not remove the object as it may be plugging the wound, helping to restrict bleeding. Put a clean circular pad higher than the object to prevent pressure on it. Bandage should not go over the object. Improvised dressing can be made out of any clean soft absorbent cloth, such as the inside of a clean handkerchief. Bandages can be improvised readily from bedsheet, pillowcase and other suitable material. A triangular bandage can be improvised with a piece of cloth folded diagonally. Bandaging a head wound can be tricky, but it is very simple. Secure the dressing with a triangular bandage. Cross the two ends at the back of the neck and tie them on the forehead, away from the wound. Fold up the tail end and tuck it in. Death by drowning is caused when water prevents breathing. When water enters the airway, it causes throat spasm, which prevents breathing. Only quick action can save the victim. Avoid getting into the water unless you're a good swimmer. Carry the casualty with his head lower than the rest of the body to reduce the risk of inhaling water. Lay him on a hard surface. Remove any debris by turning and clearing the mouth. Simultaneously tilt the head to open the airway. Check for breathing and pulse. If there is pulse but no sign of breathing, start mouth-to-mouth respiration. Swallowed water is sometimes brought up with food during artificial respiration. Turn the head to one side and clear the mouth regularly. Once breathing resumes, turn the casualty into recovery position. Place the nearest arm at right angle to the body. Bring the far arm across the chest and place it against the nearest cheek. Grab the far thigh and roll the casualty towards you with the leg propping the body. Make sure the airway remains open. A person who has stopped breathing will die in minutes. It is urgent to get air into the lungs. Lay the casualty on a firm surface and tilt the head back to open the airway. Maintaining the tilt, clear any obstruction in the mouth. Check for breathing by placing your ear close to the nose and mouth and see the rise and fall of the chest. Simply opening the airway may be enough to cause breathing to start again. If the casualty does not respond, begin mouth-to-mouth respiration. Cover the mouth, pinch the nose and blow 2 full breaths. Make the chest rise and fall each time. Continue by giving 1 vigorous blow every 5 seconds until breathing resumes. Take big breaths between each ventilation. Listen for breathing and see the rise and fall of the chest. If mouth-to-mouth is impossible due to injury, mouth-to-nose is undertaken. Hold the mouth shut with one hand and blow into the nose. In the case of small children, give one puff every 4 seconds. And in the case of infants, seal both the nose and mouth and give one puff every 3 seconds. Artificial respiration is useless if the heart has stopped beating. The heart lies between the breastbone and the backbone. Pressing the breastbone will squeeze blood into the circulatory system and can cause heart to resume beating. Chest compression is always used with mouth-to-mouth respiration, and it is called cardiopulmonary resuscitation or CPR. CPR is a delicate technique and should be used only after establishing conclusively that the heart has stopped beating. The most reliable way to discover if beating has stopped is to feel the pulse of one of the carotid arteries in the neck. To perform chest compression, kneel beside the casualty. With the fingers raised, place the heel of one hand on the casualty's chest at a spot 2 fingers width up from the bottom of the breastbone. Keep the fingers raised to prevent them from pressing the ribs. Lock the second hand over the first. Place your shoulder directly over the hand and apply pressure to the heel of the hand. Press down 1.5 inches at the rate of 60 to 100 per minute. Count as you push down. Do 15 compressions, then inflate the lungs twice by mouth-to-mouth respiration. If there are 2 persons, do 5 compressions and 1 lungs inflation. Check the pulse after 1 minute and then after every 3 minutes. When the neck pulse is detected, stop compression but continue mouth to mouth until breathing starts. In the case of children below 9 years, compress the chest with only one hand to a depth of 1 inch at the rate of 80 to 100 times a minute. Give one small breath after every 5 compressions. Continue this cycle until pulse returns. In the case of infants, imagine a line joining the nipples. Place 4 fingers touching the midway of the line. Then with only the middle and index, compress the chest to half an inch depth at a rate of 100 times a minute. Pause to ventilate the baby once after every 5 compressions until pulse returns. If someone receives an electric shock, the first step is to break the contact with the current in the quickest and safest way. Do not use the switch on the appliance. Switch off from the power point. If the switch cannot be reached, switch off the mains. If this is not possible, stand on a dry insulating material like dry newspapers or a wooden box and push the source away with a dry wooden stick. Once the casualty is freed, tilt the head back to open the airway and open the mouth. Check for breathing and pulse. If these signs are absent, prepare for CPR. If she is breathing, put her into recovery position.
In any crisis, staying calm could be the single factor to save life, yours or someone else's. Remember, life is precious, and every effort should be made to prevent loss of lives. But never do anything just for the sake of doing something. Remember, mishandling and ignorance could do more harm than good.